Tired of being tired? Let's talk about iron. Hi everyone. Today we're going to talk about iron deficiency anemia, a common health issue that affects millions. What is anemia? Anemia is a condition where your blood doesn't have enough healthy red blood cells. Red blood cells are crucial because they carry oxygen throughout your body. Think of it this way. These are normal, healthy red blood cells full of oxygen. And these are the red blood cells in anemia. Smaller, paler, and struggling to carry enough oxygen. Now let's zoom in on a red blood cell. Inside we find hemoglobin, the protein that actually carries the oxygen. And at the heart of hemoglobin, we find iron. Iron is absolutely essential. It's like the fuel for hemoglobin. Without enough iron, your body can't produce enough hemoglobin, and that leads to problems. So iron deficiency anemia occurs when your body doesn't have enough iron to create sufficient hemoglobin. This can happen for several reasons. Common causes include decreased intake, increased demand, blood loss, and malabsorption. Diets low in meat, poultry, fish, and green leafy vegetables can cause low iron intake. Internal bleeding, for example, bleeding ulcers in the stomach, surgery, trauma, or menstruation in women can cause blood loss. Increased iron demand can be seen in pregnancy and children due to rapid growth. People with certain gut diseases like ulcerative colitis, Crohn's disease, and gastric bypass are unable to absorb iron properly. These pathways lead to low hemoglobin and ultimately iron deficiency anemia. What are the signs? Well, symptoms can include fatigue, feeling weak, pale skin, koilonychia, which means spoon-shaped nails, pica, craving and consumption of non-nutritive substances like ice, chalk, etc. Shortness of breath and rapid heart rate, headaches, and more. It's important to remember that some people might not experience any symptoms at all, making it even more important to get checked. How do you know if you have it? Diagnosis typically involves a clinical examination of the patient and a simple blood test. This test checks your hemoglobin and iron levels. On a CBC, you will find a decrease in RBC, hemoglobin, and hematocrit. The reason for the decrease in all of these values is, as we know, decrease in iron, which leads to decreased ferritin, which is the stored form of iron, and transferrin saturation, which is the protein that transfers iron. TIBC, which is total iron binding capacity, is increased as the body does not have enough iron and tries to catch every iron molecule present in blood. Hence, TIBC goes up. So how is it treated? Treatment usually involves dietary changes to increase your iron intake, iron supplements to replenish your iron stores. In severe cases, IV iron is given to restore iron, or blood transfusions are done in emergencies.
Created using Powtoon.